Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, you know, I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of the things that I may go over in my videos that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 68-year-old male with a history of hypertension, blood pressure 150 over 95, and type 2 diabetes presents for a follow-up visit. His current blood pressure is 160 over 98. Which of the following is the most appropriate first-line antihypertensive therapy for this patient? Is it A, a thiazide, B, a beta blocker, C, an ACE inhibitor, or D, a calcium channel blocker? Take a moment and tell me what you got. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure that you're answering what is even being asked of you. So here, the stem of the question states, which of the following is the most appropriate first-line antihypertensive therapy for this patient, right? So let's think about it. So it's basically just asking for a treatment. But the diagnosis is provided. We know it's hypertension. So we need to look at these assessment findings and make sure if there's any parameters that may adjust how we treat, right? It also specifies that we're looking for first-line therapy. So you think about first-line hypertensive therapy, I tell y'all to think of the starting four. We have our thiazides, our ACEs, our ARBs, and calcium channel blockers that, according to the ACC and AHA guidelines, those are our first line, with thiazide being the captain of that starting four, right? So here, this patient has a history of hypertension and diabetes. Remember, with diabetes, you want to give an ACE or ARB because they need renal protection, right? So you would go with C, an ACE inhibitor here. Always make sure you pay attention if there is history provided, a medical history, okay, for hypertension management. Question number two, a 58-year-old female with a history of hypertension, blood pressure 145 over 85, and no cardiovascular disease presents for a routine checkup. She has been non-compliant to lifestyle changes and her blood pressure remains elevated. According to the ACC and AHA guidelines, what is the most appropriate next step in her management? Is it A, to start a beta blocker, B, lifestyle modifications, C, start your antihypertensive medication and recommend lifestyle changes, or D, schedule follow-up in 3 to 6 months and continue monitoring? Take a moment and tell me what you got. All right, so stem of the question here states, according to ACC and AHA guidelines, what is the most appropriate next step in her management? All right, so this is a 58-year-old female. She has a history of hypertension. She does not have any other cardiovascular disease or any other listed medical history, but she has been non-compliant. Blood pressure is 145 over 85. That's in that range that even if they're healthy, you want to start some type of therapy, okay? And it says, if it exceeds 140 over 90, we're exceeding that 140 range systolic. So you want to start medications, right? So C would be your best answer because we need to start a medication, but you also want to recommend that she starts to be compliant with these lifestyle modifications, okay? All right, and lastly, question number three, a 63-year-old female. Before I read this, let me also give a sidebar because doing my practice question course and doing these question analysis sessions, I noticed that hypertension is a common issue that many of you guys struggle with. And the common theme is what you hear in clinicals and what you have done as a nurse in practice and what you may see in practice. Now, I remember that being an issue as well while I was in clinicals, etc. But here's my thing. When I tell y'all that I designed these questions based on the current guidelines that are being tested on the exam, know that, one, I know that we do things differently in practice. Two, even specializing in cardiology, I know that how we manage hypertension and things can vary, but I'm telling you the guidelines that they're testing on for boards. So even if you need to make a compartment just to say, hey, I'm going to know this just for the exam, trust me, this is what they're testing on currently. So I want you to know this so that you can effectively answer the exam questions, okay? You know how we were always taught in undergrad to prepare for the NCLEX that you need to picture this like it's a perfect world. Perfect world, we're going straight like this textbook guidelines, okay? All right, rant over. Question 3. A 63-year-old female presents with a blood pressure reading of 158/96. She has a history of hypertension and mild osteoarthritis, but no history of cardiovascular disease. She is not currently on any medications and is interested in managing her blood pressure. According to the ACC and AHA guidelines, what is the most appropriate initial management strategy for her? Is it A, to start a calcium channel blocker, B, start an ACE inhibitor, C, lifestyle modifications, or D, start a thiazide? Take a moment and tell me what you got. All right, so stem of the question states, according to the ACC and AHA guidelines, what is the most appropriate initial management strategy for her? All right, so let's see what's going on. We have this 63-year-old female. She comes in, her blood pressure is 158/96. This should instantly tell you we need to start medications, right? Because that exceeds all goal ranges that we know based on the ACC and AHA guidelines. So we know we're going to initiate some type of medicine, right? She has a history of hypertension and mild osteoarthritis, but she does not have any other comorbidities or cardiovascular disease listed, right? So it doesn't tell us like gout or any allergies or anything that may cause us to eliminate any of the other medications. So your best answer is D, to start a thiazide, because remember what I tell y'all, thiazides, ACEs, ARBs, calcium channel blockers are our starting four, but thiazides are the top of that. That's the captain. Go with a thiazide unless there's something that you need to rule it out for. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. The things that I do offer are all linked in the bio of this channel. It will show you the list and the way to access with pricing and everything included. Okay, so go check that out. And if you have any questions, and I always say if you want to book any of the one-on-one sessions, to either call, text, or email, as I offer a variety of them. So I like to speak with you to gauge what you truly need to make sure that you're booking the appropriate session. Okay, all right, you guys. As always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.